We have been involved for the past few years developing engaging patient education material, be it print, be it online media, be it multimedia, DVDs, CDs and all that. I would like to start with one very important philosophy that we work with. This is something that I read a few years back. I don't know who has written this, but I think this is something which drives us. You tell me something, I'll forget it, for sure. I may remember it, I may not remember it, that's for sure. You teach me something, that's education. I'll learn it. Whether I understand, I grasp it, I take it, then I use it, apply it in my life, not sure. But yeah, you involve me with something, you engage me with something, and I'll remember it most likeliness forever. So that's the term, engagement. That's what we always try to work around. We talk about engaging a consumer, in our case a patient. We don't just tell him to use this, use that. We try to engage so that when a doctor talking to a patient, we tell them to engage the patient in the interaction, make him a center point or make him the important part of your overall, but eventually you are talking about treating a patient. So that's what we believe in. Immediately the next thing comes is why patient education, why it is needed, why it's necessary. I mean, of course, important points like informed decision. Informed decision, it always makes the patient comfortable about what he's going through. If you are able to date, as a doctor, if you're able to tell him what he's going through, if you're able to make him aware about his health status, the treatment that he's going to undergo, a patient will be more comfortable knowing about it, and then he will be more informed about what he's going through, what he's expecting, and then when he takes that decision, that would be much better because he'll be in a positive state of mind. He will be able to surrender himself to a doctor very well. So that's where patient education is needed. It of course develops positive approach, helps patient to take timely decision as to whether I have to take a decision right now or should I time it or maybe later on I can take it. He's made very clear about what needs to be done. It of course increases his confidence because he is then sure that I am in a safe hand. My doctor is not just here to treat me, as Dr. Shalini said, disease or illness, but he is here to take care of me. So he will be more confident about surrendering himself to his doctor. Of course, decreasing treatment complications, less chances of medical legal issues, which I'm sure Dr. Datar would surely agree with, that communication plays a very important role. And as Dr. Abhizar said, communication, which basically to connect to your patient in his language is very important. It of course promotes healthy living, increases adherence to treatment and all that. So this is quite known patient education. But then since I'm talking about patient education material, and since we have been doing this for the past many years, we have realized that keeping in mind India, we have a lot of barriers. But before that, we would like to understand what are the objectives of developing a good patient education material. Of course, first and foremost, adaptation. Adaptation basically is to understand what your patient needs. To understand, to come to his level and understand what he needs, what he is looking at, what is his past experience, what is his cultural beliefs and understanding. Adapt that and then come out with a teaching material for him which can relate to his self. Not something which you say, no, as a doctor I know this is the information you need and you should go through it. It doesn't work that way. You basically need to understand what your patient needs. He may be, in a cosmos city like Bombay, as a doctor you may be seeing patient from 10 different class, culture, languages. So you need to understand what his background is and then prescribe information which is very much related to him. Create knowledge sharing environment, basically to create an environment conducive to learning, and of course involve patients for self-evaluation, provide them motivation to build up good programs. So that's basically what we always look at in terms of when we create patient education material. We try to figure out on how best we can actually connect this. How I think this is some problem. Since we have been doing this, developing it, India, like they say, is many countries. You go from state to state and you see a lot of differences in culture, even in, for that matter, language. So these basically are some of the important barriers that we have been facing while producing patient education material, right from language. Maharashtra, and we just cross over to Gujarat, neighboring state, and we find it difficult to even hard sell something which is done in English or Hindi. We have to go for Gujarati. Now even within Gujarati, we have problems because a patient sitting in Vapi will not understand the dialect which is being used in Saurashtra, down south Saurashtra. And same is the case with a guy in Saurashtra, because if I make something which is a native based language, it becomes difficult for someone within a state but who is staying in some different area to understand it. So that's something which is a major problem for us. But then we always try to understand how best we can come over this problem, how best we can make it more neutral so that a consumer understands. And of course, we need to make it in a way where it relates even with a doctor, because for a doctor, when he's talking to a patient, he uses specific terms. Now, these terms are universal. When he's talking to a patient, if you say in Gujarati arthritis or jodo ka problem or jodo no problem, he may not understand. But if you say Sandiva, he may understand it very well. But the problem is, if you go to Saurashtra, he will not understand. So we try to work around these aspects and make sure that language, translations and all this are in line with how they are practiced medically and how a consumer at the same side understands it. Lack of support system, of course, that's an inherent problem in India. As Dr. Abizar said, in UK you have the moment a doctor.